Hello, I'm Dana Levenberg, member of the Assembly for the 95th District of New York State. Welcome to my podcast series, Building Healthy Communities. My mission as a legislator is to build healthy communities in every sense of the word. Environmentally healthy, economically healthy, physically and mentally healthy, all through the lens of equity. In this podcast series, I talk with leaders, advocates, and others who are helping to build healthy communities here in the 95th Assembly District and beyond. Along the way, I will share information and resources for local residents and other news that you can use. Today, I'm joined by Cynthia Knox, who is the CEO of Caring for the Hungry and Homeless of Peekskill, also known as CHOP, which is located in Peekskill, New York. It's the only homeless shelter north of White Plains in Westchester County. CHOP offers programs aligning with their core belief that every person is entitled to safe and affordable housing and healthy, nutritious food. CHOP operates a shelter for unhoused adults and veterans of all genders, a collaborative housing and supportive services program for domestic violence survivors and their families, a permanent supportive housing program for individuals with a disability, and a sizable farm to pantry food pantry. CHOP also recently announced a new program called Tierra Solida, or Solid Ground, that provides low-wage workers who fall behind in rent or utility payments due to a loss of wages from an unforeseen emergency situation. In today's episode, Cynthia will share more about CHOP and its mission and how you can access their services or help out your neighbors in need. Welcome, Cynthia.
Thank you, Dana. Good afternoon. It's a pleasure to be here. And thank you for all your work with your colleagues for getting critical funding in the budget, for protecting the environment, for affordable housing, restoring education funding, among other initiatives. We know that the work is not finished, particularly around issues such as affordable housing and eviction prevention, but this budget will have a significant positive impact upon the residents of the 95th District.
Well, thank you so much for the shout outs for all of that. And you're absolutely right. We have so much work to do still. We're glad that we were able to start to chip away at some of the issues surrounding housing and making sure that people can afford to live here in the 95th Assembly District and throughout the county and the state. But we know we have a whole heck of a lot more to go. So, talking a little bit more about CHOP, what is Caring for Hungry and Homeless of Peekskill, and what is its primary goal? Just the basics.
It's a mouthful, which is why we use the acronym. So, CHOP, our work focuses on housing and food equity in Peekskill and the surrounding communities. We support people, as you mentioned, living with domestic violence, veterans experiencing homelessness, immigrants, people with mental health issues, and other low income individuals and families.
And what inspired you to get involved with this organization to begin with? I mean, I know that you've always kind of been a community oriented person, but this was a big one.
This is a great one. I'm trained as a public interest lawyer, and I worked for many years in HIV/AIDS advocacy, and then I went into civil legal services work. And the opportunity to work in my own community and to help make a difference in the lives of my neighbors is something that brings me great satisfaction.
Well, we are so lucky to have you here in Peekskill and really helping out our entire community and well beyond. What services does CHOP provide, and who is eligible to receive them?
Well, we operate out of a holistic model with the understanding that food and housing insecurity are connected to other issues such as health outcomes, cognitive development for children, and neighborhood stability. So, our six programs focus on emergency needs as well as preventative efforts. As you mentioned, we operate a homeless shelter for unhoused adults of all genders, including veterans, um, two housing programs for specialized populations, domestic violence survivors and their families, individuals who've been chronically homeless, and live with a disability. Our very large farm to food pantry, as you referenced, which post-pandemic has exploded. Pre-pandemic, it was a much smaller food pantry. And our newest program that we developed for low-wage workers and immigrants to ensure that we can help keep families and neighborhoods stable as much as possible, because once a family or an individual starts sliding off that precipice of homelessness, the climb back up is so much more difficult. So we work in
Absolutely.
partnership with our community, other community organizations, with elected officials such as you and your staff and other elected officials. We all work together in community to try and move these efforts forward.
Absolutely. And can you just, I'm just curious about the post-pandemic explosion. Was that attributable to, would you say, to just people finding out and learning about the services that you provide? Or was it just, did it expose something in particular? Or did you actually just get to a point where you were providing even better and more, local and nutritious food that people were then finding out about and counting on? Just curious.
That's such a great question. I think it's a combination of factors. Before the pandemic, we would serve several hundred people a week, and then as soon as the pandemic hit, we started serving thousands. And at that same time, that's when the scales really fell from our eyes. We used to operate on a charity model, which is the prevalent model for food pantries. You take donations and you hand food out to people, but there's not a lot of thought about what kind of food you're giving people. And because of our community and the high incidence of chronic illnesses such as hypertension and diabetes, we realized that it was really critical that we brought healthy, nutritious, and culturally appropriate food into the community. So we were very fortunate to be able to work with some funders who understood what we were trying to do, and they provided funding so we could make that pivot to farm to pantry and provide a lot of fresh vegetables, a lot of lean proteins. So I think it's a combination of, the pandemic, when so many people were thrown out of work and living very precariously, and the numbers increased, and then our real focus on healthy, nutritious food. And so at the height of the pandemic, we were serving 85,000 duplicated individuals.
Really?
Now, a lot of what drives the need for the food is housing affordability. A lot of families, because they don't have the wages to support healthy, nutritious food and housing, they feed their children by getting food at Fred's Pantry and other pantries so that they can use their wages to keep the family stable in housing. And so
Amazing.
last year in 2023, we provided food to 74,000 duplicated individuals. And when the pandemic hit, we also implemented a system of services because, again, we try and operate on a holistic model. All these issues are intertwined. So
Absolutely.
we knew that people needed to talk to healthcare providers, insurance providers, legal providers. So we set that up at Fred's Pantry to have those type of services accessible to people.
Really incredible. I'm so grateful. I was so pleased to be able to support CHOP's Welcome Home for Veterans program with a $20,000 grant from New York State in 2023. Can you share a little bit more about this program and what CHOP offers for veterans and how they can access them?
Absolutely. And we are very grateful for that funding, which I'll speak to in a minute. Our program, Healthcare for Homeless Veterans, is the only program in Westchester County. And we work very closely with the VA in Montrose. The program provides transitional housing, case management, housing location services, and linkages to VA services for homeless veterans. And as I said, it's the only program in Westchester County. Veterans can stay here for up to 6 months while they're doing a housing search and working with the VA. The funding that you obtained for us is really terrific funding because it goes to the core of what veterans need. We can supply clothing, food, hygiene products and the basics of that. But as you probably know, veterans are a very closely knit group, even among different branches, although there's rivalries among
Yeah,
branches. But
I
if you
do
get a
know that.
bunch of veterans together, so we're waiting for the contract. As you know, it takes a little time sometimes for the contracts to come
I
through.
do know. Yes.
Yes, and that's just the nature of the beast. And what we're going to use the funding for is to bring facilitators in to work with veterans on workshops that they sort of set up and create, and also activities, bonding activities. Like there's some equestrian programs that are specifically targeted to veterans. And we want to do other outdoor activities that bring the veterans together in a social situation. So we're really excited about that funding and the fact that this provides us with an opportunity to work with the veterans to help them heal, in doing something beyond, the physical. So it's really fantastic.
I do know that equestrian programs can be, very healing, but I didn't know that we still had like the cavalry out there. So, but it's good to know. It's good to know that. That's wonderful. I'm looking forward to hearing how those programs go, and also that it's great to hear that they're somewhat directed by the veterans to make sure that we're actually meeting their needs. What help does CHOP offer for the homeless, and how can eligible recipients actually sign up? How do they find you essentially?
Well, we have the variety of programs, and with our shelter program, including for the veterans, there's very specialized ways to access those programs. And anyone who's interested in learning about those programs should contact us, send us an email at CHHOP.org, and then we can help guide them through the proper channels for that. And the other programs that we provide, and we've talked about, Fred's Pantry, anybody can walk over to Fred's Pantry. We distribute our food Wednesday afternoons from 4 to 6 and Saturday mornings from 9 to 11. So somebody can walk over there, register, and they will be provided with food. In terms of the housing programs, there's a coordinated entry process through the county. And again, that would be where somebody would want to contact us at chhop.org, and we could help guide them through that process. Um,
Perfect. Yeah.
one particular barrier that we have with helping people reach independence is something that you've been very involved in speaking with us about, and many people are not aware of this. For individuals who are staying at a homeless shelter and their residents, they must pay 90% of their income to the Westchester County Department of Social Services to stay in the shelter. That means that people can't save to move on towards independence, and it also operates as a disincentive to work because none of us want to work for 10% of our wages. So that is one of the barriers that we face in working with people to help move them towards independence. And we are working on that, and we hope that regulation will be changed in the near future.
Yeah, and we'll continue to work on that together. And I know that one of the other things that I was working on in Albany was making sure that that homeless people had access to the internet. Because as you were mentioning,
Yes.
barriers, that could also be a barrier to finding a job or finding other kinds of housing or things of that nature. And I know that some unscrupulous shelters also sometimes try to collect money from their residents, and in a way that makes it very difficult for them to actually have access to the internet. So, hopefully we're going to work to continue to get that legislation passed as
That
well.
is fabulous legislation. And I have to tell you, Dana, that I didn't know that shelters didn't all have internet for their clients
Yeah,
because, we have internet and the shelters in Westchester County, because how in the world can somebody, find housing or find employment if they don't have easy access to reliable internet? And that
exactly.
obviously goes for people who are not in shelters as well, why that's
Exactly.
such a critical infrastructure issue in our county and country.
Absolutely. Yeah. So interesting. I hope that this is coming through clearly because I just got a notification that my internet wasn't stable. So let's hope that we're still going strong here. Okay, and then I guess the next question is just we talked about people who are homeless and then people who are maybe experiencing or a victim of or know somebody who is a victim of domestic violence. How do they connect with you directly? Does that go through one of the other services, like Hope My Sister's Place? Do they help
Mhm.
connect with you, or is there another more direct link to that?
That's another great question. There's two primary ways. One is through our RISE program, which is Rehousing in Supportive Environments. We operate that program in collaboration with Lifting Up Westchester and My Sister's Place. It's a program that provides housing, case management services, domestic violence support services, and employment support services for domestic violence survivors who are fleeing or are homeless. And that's a fantastic program. The collaborative model really works very well, provides the holistic services, and that is one of those programs that goes through what we call coordinated entry. And that's where people would want to contact us at chhop.org. The second way is that we know that there are, you just mentioned our two fantastic domestic violence organizations in Westchester County, Hope's Door and My Sister's Place. And they provide absolutely tremendous services, and we work very closely with them. Because we only have two domestic violence providers, there's not enough shelter for domestic violence survivors. So we get a fair number of domestic violence survivors who flee to the general shelter. And because we have staff who are trained in working with domestic violence survivors, when somebody flees here, we're able to automatically just start working with them, contact the appropriate DV providers, get them the services, and then hopefully, if we can't get them into housing, such as the RISE program right away, at least work towards getting them into a domestic violence shelter. So those are the two primary ways with regard to CHOP services.
That's amazing. I mean, I really, again, you could really have like really strong services for so many different groups of people who are in transition or are in difficult housing situations that are, challenged. How is CHOP able to assist those who are trying to make a living?
Yeah, it's hard out there, right?
Yeah, it's hard out
For a
there.
lot,
Yeah,
for a lot of people. So our two primary preventative programs that we operate right now is our Fred's Pantry, which, as I mentioned, many people access Fred's Pantry for the food so they can continue to pay their rent because once a family is rendered homeless, um,
so much harder.
maintaining employment, school, even though there's
Yeah,
provisions, legally for the child to stay in the same school, it's devastating for the family. So that's
absolutely.
one way that we assist low wage workers for maintaining. And the second is our new Tierra Salida program, Solid Ground. Many people, including low wage workers and immigrants, experience a short term emergency. Take, for example, somebody that is a server at a restaurant and she has two children, and one of the children gets sick and stays home from school for a couple days. Well, there's no sick pay for the server who stays home. It's the end of the month, and the server is short on rent. Now, the server can continue to pay rent long term, but has this short term emergency. And the landlord's not going to say, well, that's okay, you're $300 short this month. So that's a situation where somebody can come to us, we can sit down with them, talk to them, and see, yes, if we just help this person this little bit one time, they get over the hump. And then we're able to say to them, is there anything else going on in the household? How's your kid doing in school? Do you have a doctor? Do you have this? Do you have that? So that by the time we leave that client and that family, we have done everything we can to help stabilize them. And that
Amazing.
then has an impact on the community.
That's
Thriving
phenomenal.
families, thriving individuals plus thriving families equal thriving communities. That's our motto.
I love that. I mean, and really, it's just amazing. And Tierra Solita, I love that solid ground. theme, because what you're really saying there is you really are not just helping them in that for that one short-term
Mhm.
emergency, but really finding ways to help them so they don't find themselves back in those short-term emergencies again and again, and putting them on solid ground, and making sure that they have the support and the wraparounds that they need to be on that solid ground. So that's really, really so laudable, and so grateful for all that you do, and also just how you see and how you've evolved, over
Mhm.
the time that you've been operating, to see what is it that you can do preventatively instead of reactively to help people stay out of homelessness, and have housing stability and other protections in place.
And
So
we
I
do
know
it
there's
in
been,
community.
say it again.
We do it in community,
You do it in
right?
community. Yes,
None
you
of
do.
us can do it alone, right? We don't.
Absolutely. Yes, I said those words myself today. I know there's been a lot of information in the local press, and concerns in the community about the future of CHOP, and we can see why, because knowing all of the wonderful things that you do for the community, nobody wants to see you go out of business. So can you talk a little bit about what the most pressing need of CHOP is today and why?
Permanent location, permanent facility. So we are always working on relocating the facility, as you well know, and um, what we are looking for and what we are trying to create is a 15,000 to 20,000 square foot facility that allows our clients to live in dignity with a commercial kitchen so that we can cook for our residents and cook with our residents, and that we have private office space for our staff who right now, as you know, you have visited here, work in, for the most part, in a very big open space area, and separate areas for training programs. We are very limited in the training programs that we can do now because of the space. But there are a plethora of opportunities for us to bring the kind of meaningful training programs that can help our clients move forward with independence. And we work with community partners, we work with elected officials, and we know that they are going to help us realize this dream.
Absolutely. So I guess that's the answer to my next question, which how are you planning to enact the plan of getting to this new location? What happens, once you actually get there? I'm certainly hopeful that we are going to be able to help you get there. And I know, we've been talking with the county and with, again, different state offices to see what it is exactly that we can do. And I know that we have some commitments from the assembly as well to see what if there's any way that we can help. So I guess part of it is just finding that perfect spot, and then trying to move forward. Is there any particular hope right now in a specific area, or is there anything that you would suggest for other people to get involved to support CHOP and its services?
There are so many ways that people can get involved, and I'll come to that in a moment. But I first want to thank you for being such an advocate for the community and being an advocate for us as we go through this very difficult transition at a time when real estate has skyrocketed. So it
Yeah.
makes it that much more challenging. And we're so appreciative of all that you have done to help engage all these different parties to try and address this. The different ways that people can get involved are volunteer. Pretty much, we operate so many programs that if you have an idea and a dream about volunteering, we can probably figure it out with you. But specifically, we have people that bring meals. We have people that volunteer at the food pantry. We have people that come in to the shelter and do programs, workshops, resume writing, stress reduction. We have people that work with our RISE, rehousing and supportive environment clients, doing Zoom support groups and other types of groups. So we are very flexible because we need to be flexible. And excuse me, again, if somebody has an idea, contact us at chhop.org and we'll get back to you and talk about how we might work something out. And of course, you can always donate. We love donations. You can also go to the website for that. And you know this very well, Dana, our turkey trot, which is coming
Absolutely.
up. It's not too far off now,
Okay,
November
let's not
23rd.
push it. Let's not. Well, I don't exactly know when this is going to run, but right now we're not even haven't quite hit summer yet. And we're already talking about turkey trot. But yes, it will be. I'm sure by the time this runs, probably it'll be right around the corner. So it's a lot of fun, and it's a great way to raise money and also be part of the community.
November 23rd.
You already got the date. All right, good, good. We got it out there now.
Absolutely.
Okay, November 23rd. We'll be there. Be there or be square.
Yeah,
Don't be
exactly.
a turkey.
That's right.
Any case, so that is wonderful. Thank you so much. I'm trying to just make sure that I didn't miss any questions. Um, thank you for joining me today to share all of the great work that CHOP has been doing in the 95th Assembly District. We are so grateful for you, Cynthia, and for the work that all of you at CHOP have been doing to improve the well-being of individuals and families throughout Northern Westchester and beyond. And grateful again for your partnership and for your allyship. So thanks again. And I don't know if you have anything else that you want to add before we close out. Otherwise,
Thank you so much, Dana. It's been a real pleasure.
appreciate it so much. And that's it for this episode of Building Healthy Communities. And I hope to see you all again very, very soon.
Bye now. Take care.
Bye
Thank
bye.
you.